Welcome back to Dr. Alain Danino's channel of plastic surgery. If you enjoy this channel, don't hesitate to subscribe and give it a thumbs up. Today, we'll be discussing breast reconstruction using the DIEP flap. The goal is to reconstruct the breast using tissue taken from the abdomen. First, we need to identify the perforator vessels, which are small blood vessels coming from the abdominal wall. Here we see the general surgeon performing mastectomy by removing the breast cancer while preserving the skin envelope. The principle involves performing a dissection in a plane that allows removal of the entire mammary gland by passing through what is known as Duret's crest while carefully preserving the skin envelope. The dissection continues across the full surface, detaching the gland from the skin. Once the underlying chest wall is reached, the oncologist surgeon carefully lifts the gland off the pectoral muscle, removing the fascia of the pectoralis major. This dissection proceeds from medial to lateral. The entire glandular tissue is removed. Next, we expose the third rib to access the internal mammary vessels. We remove the third costal cartilage using a small bone elevator. This resection of a rib cartilage fragment does not destabilize the thoracic cage and gives us access to high-quality vessels, the internal mammary artery and vein. Here, the surgeon uses a ronger to remove bone and reach the back part of the rib or perichondrium, which, once opened, provides direct access to the internal mammary vessels. These vessels are dissected along the length of the space and isolated using a small silicone loop. We can see here the vein, followed by the artery. Meanwhile, a second team is raising the DIEP flap. They lift the skin and fat of the lower abdomen, and then carefully pass through the rectus abdominis muscle, ligating all the perforators to completely isolate the flap. There is no muscle in this flap, only skin and fat. This new breast is then transferred to the chest, where it will be reconnected. Here, under the surgical microscope, we see the vein, then the artery. We begin by positioning the flap correctly. Then under the microscope, we first connect the vein using a coupler, a small device that automatically joins two veins. By precisely aligning the flap veins and the recipient vein, it allows us to create a high-quality venous anastomosis. We can see the surgical team placing the flap vessels alongside the recipient vessels, then tightening the coupler. Once released, it forms the venous connection. For the artery, the connection is done manually under the operating microscope, typically with a magnification of 6 to 10 times. The abdominal wall is then completely closed, leaving a scar that resembles a tummy tuck. And here we see the final result after the breast reconstruction.